delighted to be here today, and especially grateful to be able to talk about how we can work in the best way possible to prevent long-term negative consequences of divorce and separation on children. And I just want to take a minute to express some appreciations both to Florida International University for hosting this opportunity, Division 53 of the American Psychological Association, and to the Children's Trust for supporting this effort. You know, positive psychology has put a lot of effort in recent years to talking about gratitude, and gratitude is one of my favorite topics. So I also want to just take a minute to express my appreciation for having work that I love. And I'm incredibly grateful to the children and families who have shared their stories with me over the years and allowed me to learn so much from them. I've worked with children and families for 25 years, actually 30 years now. The time's gone quickly. And I continue to be so inspired by their courage. And when I think about children and our work with them, one of the things that often comes to my mind is how we're all in very pivotal roles to shape better outcomes for children and families. So in many ways, what we do in our work, our practices, the things we say, the actions we take, is really in many ways on the sacred ground of a child's life, a family's life. So all the more reason for us to be mindful of our choices and to be accountable for the kinds of programs we offer to children and families, and for the care that our efforts need to involve. So that's why I'm so excited about this initiative of evidence-based practice. And the program I'm going to be talking about today is an evidence-based parent education program called ACT for the Children. It stands for Assisting Children Through Transition. And there are materials here. The program is available for dissemination. There's a presenter's manual, a manual that parents receive, and some of the videos go along with it too. Much of what I'm going to be talking about this morning is included in my book, Putting Children First, and all of the research underpinning what I'm discussing today is included in the book, which was the book was really an effort to translate research into practical, proven, and effective ways that professionals and parents can be reducing the stress of a breakup on children and really helping them to come through it with healthy development and hopefully resilience. So a big part of what I'm going to be talking about today is what do studies show? What are the factors that reduce the risk, the well-known risk of divorce on children? But also, what are those very important protective factors that really relate to children's resilience and better outcomes over time? And I'll be reviewing what some of those things are. But if we start for a minute and just put ourselves into the shoes of a child, I think that one of the first things that becomes very clear is that for a child, they are, if they had a vote about changes in their family, it would be a pretty clear, resounding no. And that so often the changes for them are multiple. There's obviously a loss of one parent from their family residence, but also changes in sometimes school, financial changes that might result in a change to a new neighborhood, and sometimes even loss of an entire way of life. I'm going to briefly talk about the research, very briefly. We know that over the past 40 years, the rates of divorce increased dramatically and then leveled off, but still at very high levels, so that the U.S. does have the highest rate of any Western nation. And if we look at, I've been doing some cross-cultural research with other countries, and the consequences, the impact is similar across countries. From a child standpoint, I think a universal reaction that children have is, what's going to happen to me? How will I be affected? And sometimes children's fears are far worse than the reality. So that too has implications for information that we want to be sure that parents give their children, that we as professionals help children understand, have an accurate perception of that it's an adult issue, not one they caused or is responsible for. Some very sophisticated meta-analytic studies have identified some of the consequences for children when they go through disruption in their family, and certainly decreases in academic achievement, psychological adjustment is affected, behavior, self-confidence. And a lot of these meta-analyses come from the research of sociologist Paul Amato and his colleagues. And they also followed up into adulthood and found that some of those risks do endure, including a lower socioeconomic status, poorer physical health and sense of well-being, and weaker emotional ties to parents, and higher divorce in their own lives. Certainly, these are sobering long-term outcomes, but I really want to be clear to emphasize this is not a uniform response for all children. In fact, we really need to remember these long-term consequences are for a significant minority of children. So that means that there are many, many children, the majority, who after a period of adjustment are going on and their adjustment is quite healthy. Doesn't mean that there aren't painful memories and feelings of distress. Resilience, of course, does not mean immunity to painful memories and feelings. So the good news in all of this research, and this is a message I very much want to convey, especially to parents when they're in the midst of going through such painful changes, that these outcomes are not inevitable. There's tremendous diversity in how children adjust to a separation and a divorce over time. And the key for all of us in our work is to understand that research that can really give us very important guidelines for prevention and intervention. And that research includes understanding what the risks are for children over time and working to reduce those risks, and also understanding those very important protective factors. And I think this is an exciting area of research, because when we can be guided, it's almost like a guiding light to focus on, okay, let's think in our practice, in our work, what are the ways that we can be reducing the stress for children and families? And how can we work to also bolster those factors that really promote children's resilience and their very healthy development over time? So let's take a look briefly at what the risk factors are, because this is the underpinning for the intervention I'm going to be talking about today, the Act for the Children program. This is the research that underlies that work. We know that for children, there are certainly those individual characteristics that can put children at risk when they have for just about any life change. When children have a more difficult temperament, when change is tougher for them, when they had difficulties even preceding the marital disruption and the family changes, when there are feelings of responsibility, that guilt, when they lack coping skills, and when children are caught in the middle of conflict between parents. Definitely risk factors that we want to be addressing in our practice, in our research, in our interventions. What are some of the characteristics of families over which parents may have some control? Certainly, about every controlled study ever done cites ongoing conflict between parents as having a detrimental effect on children. When there are poor or strained relationships between parents and children and multiple transitions, we all know when we go through tough times in our lives, if we're overwhelmed with more than one change that can be, it's an added stress. There's some well-documented economic decline that goes along with separation and divorce. And one of the more recent studies is showing poor quality of parenting as a major risk factor, and certainly exposure to violence. When we think about, as I mentioned, conflict relating to harder times for children, I think we have to consider that certainly not all conflict is created equal. It's when conflict is ongoing, when it's verbally and physically aggressive, when it's unresolved, and when it's focused on the child. As this child's drawing shows, he's caught in the middle between Fort Mom and Fort Dad in World War III. And I also have developed a children's program, and one of the things we've heard over the years when children give advice to parents, they often say things like, "Don't use us as bullets, don't let us be caught in the middle." Not only is ongoing conflict a risk factor for children emotionally, it also affects children's physical health. There's some new research that talks about exposure to conflict relating to higher incidences of illness. A psychosocial model of wellness certainly links the impact of stress and anxiety and higher incidence of physical illness. And very often in studies, including some of my own on children's reactions, is reports of higher anxiety and headaches and stomach aches that are often linked to that anxiety and stress. So if we consider the pathways of how conflict affects children, there's certainly a direct pathway to children's mental health problems, but there's also another pathway, and this is extremely important information for us to share with parents, that ongoing conflict between parents has a direct pathway, a direct negative effect on parents' ability to be good parents. And I think we can all understand how that link could happen. That when parents are locked in their own animosity and conflict, it has an effect on children's emotional security, on their own sense of control. It certainly models for them aggressiveness, and may relate to externalizing problems, acting out behaviors. There's also a pathway with an impact on parenting, poor parenting, and both of these have an impact on children's behavior problems, both internalizing and externalizing. So the message here that we would want to translate from this research to parents is there's so much they can do to reduce these two risk factors, containing their conflict and focusing on keeping their children out of the middle. We certainly can understand the power behind this drawing when a child feels torn between two parents. It's one of the worst possible feelings for them to have. Loyalty conflicts create tremendous anxiety for children. So, as we know, there are many different ways that this conflict can unfold for a child and affect them. And we're going to do a role play later this morning to demonstrate that. But certainly when children are asked to carry hostile messages between parents, when they're told negative things about the other parent, or even not allowed to talk about one parent to the other, can put them in a tremendous situation of anxiety and split loyalties. I also want to emphasize, though, that of course, in any relationship, and certainly when two people are trying to disengage emotionally, conflict is a natural part of ending a marriage, ending a relationship. So we're not saying that you shouldn't have conflict, but how it's handled makes all the difference. And there is some very good evidence that when children see parents managing conflict in healthy ways and maybe even resolving it, it has a positive message to children and provides a model of how they can manage conflict in their own lives. So certainly when we consider conflict, it's a powerful predictor in how children do over time. I want to shift gears for a minute and consider from children's eyes. I often think about things through the lens of children and the losses that they may experience. And they certainly talk about family life as they knew it changes. Sometimes family relationships, even relationships with extended family. They sometimes talk about having to move when there are economic changes, tough financial situations, and having to move maybe to an apartment where a beloved pet can't go, so there's a loss for them there. And very often, when parents develop new relationships, what I refer to as, for many children, I hear them talking about this in the groups that I've done with children over the years, there's sometimes a fear of replacement. And children don't often say this directly to parents. They can't, it's too hard. But what they'll say in our groups are things like, I hate that woman my dad's dating. I hate my mom's new boyfriend. He's always coming over and eating up all the good food. And you know, sometimes in our groups, especially when I was first doing this work, children would come in and talk about how mean and nasty their new stepmothers were. And I have 4 stepchildren myself, and I wondered, boy, is this what they really think? And groups are wonderful opportunities to address children's feelings. And I said, you know, sometimes when you feel that angry about something, when you have such strong feelings, there are some other feelings underneath. And I'll never forget this conversation that day, because in kind of misty-eyed, a few of the children said, well, yeah, I'm worried my dad loves her more now than he loves me. Or, I'm worried that he loves her kids more. He picks them up and tosses them up in the air like he used to do with us. Or my mom seems so excited when she talks to her new boyfriend, and when she talks to me, all she says is, did you clean your room and did you get your homework done? So underneath what may look like obnoxious reactions to a new partner, when a child says, ugh, does he have to be here again? Does she have to come with us? It's so helpful for us to help parents understand their children need reassurance that they will not lose the special place in their parents' heart and that nobody takes their place. So, I think rather than my talking, I want to share from children's own very eloquent ways of expressing what their feelings are.
I think I mainly lost myself because I just didn't know what to do, because my dad lived somewhere else and then my mom lived with me, and I just didn't know who to live with.
I think the biggest thing I lost in the divorce was the family events that we had. Sitting around the table and playing board games. I mean, little stuff that, you know, wow, my family does that too, and a lot of times when we did do that, it's like, yeah, you know, I really don't want to play tonight, Mom. And as a matter of fact, I really never want to play because it's all boring and all. But when I look at that, we really had a lot of fun.
But I was really angry, you know, because I wasn't seeing my dad, and I loved him a lot. So, and that, you know, it scared me because I thought he might not come back, and that wasn't good.
That wasn't good. The beauty of children's simplicity and how they can express such terrifying emotions as being abandoned. And again, the implications here are how important it is for us to help parents understand, because children speak what I call childrenese, and they can't always tell their parents what they're feeling.
Well, when my parents split up, I thought it was my fault because I heard all the yelling because I was upstairs doing something or reading a book. And I went downstairs to stop the fighting, and I thought that I was the reason of all the yelling and stuff.
Precious children, poignant, painful feelings that they have. And how important it is for us in our practices, in our programs, our interventions, in our work with parents, to help them understand these things that children so often feel but seldom say. And very often we'll hear children say, just like this boy did, I could hear my name come up over and over again.
Well, when my parents split
and I
up,
thought it was my
it was
fault.
my fault because I heard all the yelling because I was upstairs doing something or reading a book. And I went downstairs to stop the fighting, and I thought that I was the reason of all the yelling and stuff.
So important that we work to clarify these misconceptions and give parents the tools to be able to do that. A survey that I did last year, just asking children what were the hardest things for them about their parents being apart. Of course, many children talking about when they're with one parent missing the other. Certainly that fear of conflict, sometimes going back and forth between homes, especially as this child conveyed when parents are locked in their own icy conflict and not communicating, or when transitions are tense and sometimes hostile. So this child showed he felt like he was being passed back and forth like a volleyball. And for children, there are worries about their families, not having enough time with parents, and sadly, 29% of children saying, sometimes I feel like I don't have a family. Those were children, again, who had higher rates of conflict in their families. Certainly, parents' well-being can have a major factor in how children do over time. This was a child who did not want to go to school, did not want to leave home, and when the school referred him to me, it was clear that he was worried about his mom, who was often depressed and having a very hard time. So it's so important that we not just take the superficial reason for referral. They were thinking that he was just having a hard time in school and didn't like his teacher, but actually there were many more concerns that needed to be addressed. So when I talk about what children feel but seldom say, what I'm referring to is so many worries, so much anxiety that children have that parents aren't often aware of. The APA did a survey in 2009 about showing a gap between what children experience as stress and parents' awareness of it. And it showed that there's quite sometimes 3 times the amount of worry and anxiety than parents are aware of, particularly just children in general, but especially adolescents having worries about doing well in school, about family finances, having trouble sleeping, even physical symptoms like headaches. So why is it that children aren't telling their parents? We could probably figure this out, but sometimes with really young children, they don't have the emotional vocabulary to put it into words, or they may want to protect a parent, particularly when they see parents are already stressed and or angry. They don't want to create more conflict. They don't want to make waves. It's already hard enough. Certainly with adolescents, they're becoming more independent, may not want to divulge what they're feeling, may becoming more disengaged from parents. And frankly, for many children, they worry, well, if I tell my dad how angry I am, if I tell my mom how upset I am, they may not continue to love me. So, those are the risk factors. And now we want to talk about what are some of the protective factors, because this is information that I think is so extremely important and needs to be a part of everything we do and say when we're working with children and families. I really like Frederick Douglass's quote about prevention. Even though I would change it to strong people, or men and women, it's easier to build strong children than to repair broken men. And certainly that has a lot of implications for wanting to work in a preventive way. If we think about what are some of those protective factors for children, absolutely we need to help them develop an emotional vocabulary, help them be able to identify their feelings. The scope of my presentation today is on working with parents, but this is information that parents can be doing with their children, and it's also a major component of what we do in our children's program. And we all know how important it is to be able to talk about what we're feeling. We've known that for years. But there's recent neuroscience research that I think absolutely reinforces the power of what can happen with being able to label emotions. Some fascinating research, particularly using functional MRIs, this was Lieberman's research at UCLA, shows a calming response in the limbic system, in the amygdala, when emotions such as anger are able to be labeled and put into words. And when there's that calming response in the limbic system, what happens? It moves, and this is shown on the MRI, I love this, moves the activity to the prefrontal cortex, which of course is related to better judgment, problem solving, and soothes that emotional response. So when we're working with parents who are in so much stress, sometimes a lot of conflict, helping them to be able to express what they're feeling, as we're going to do some hands-on work with this a little later this morning, but also helping to teach parents how they can listen for their children's emotions and be able to help children be able to label what they're feeling. We're really helping to lay down children's neural pathways and create the opportunity for children to learn problem solving and how to manage strong emotion. Other protective factors that relate to children that we can be informing parents about is certainly helping them disengage from misconceptions that family breakup is somehow their fault and somehow they contributed, or their responsibility to reunite parents. Helping children to learn that and differentiate problems that they can solve and have some control over versus those that they can't. We all know this. What happens when we stay really focused on a problem that really is beyond our control? It's a recipe for frustration, sometimes depression, and the same with children. So we want to help children identify what is within their control, like doing well in school, the agenda of being a child, doing well with their sports and activities, and disengaging from adult problems. So the two factors shown repeatedly in research that predict children's adjustment, longitudinal, over time, is when the level of conflict between parents is contained and when there's high quality of parenting, hopefully by both parents. And these have been shown repeatedly to contribute to children's resilience. So this is one slide with a lot of words on it that summarizes so many studies of protective factors that relate to families. So when children are protected from conflict, not put in the middle of it, when there is high quality, authoritative parenting, and when the psychological well-being of parents is healthy, and when there's cooperative co-parenting, and you'll hear me say this a number of times today, except in situations of domestic violence or abuse. And I'm going to talk about safety as the number one priority, and I'll get into that a little more. And certainly healthy relationships between children and both parents, and household structure and stability that gives children a sense of security. Having meals together, having routines, and certainly supportive sibling relationships. Outside the family, as we're talking about today, evidence-based preventive interventions for children and families, but also legal procedures that reduce conflict. And the program I'm talking about today, the Act for the Children program, includes all of this information. I just want to take a minute to take a deep breath in. I love this photograph. I think it creates positive changes in me when I look at it. Quality parenting is one of the most powerful predictive factors. You know, our topic today is children dealing with family changes, but truly quality parenting relates to every child, doesn't it, in every situation. So it is a critical protective factor, and I just want to take a minute to define what I mean. Quality parenting is also known in the research literature as authoritative parenting or effective parenting, and what it's referring to is the relationship between the parent and child. It includes what I call two essential pillars of parenting. I refer to it frequently as the language of love. There's the warmth, nurturance, emotional support, and limits. So discipline as well. And there's some very interesting new research that shows that quality parenting by mothers and fathers has the potential to modify children's resilience even in high conflict divorces. This is research by Erwin Sandler and Braver and their colleagues at Arizona State University. And I think it's very fascinating to note that there's a compensatory effect that they're finding, that high quality parenting by one parent can help to buffer low quality parenting by another parent. And very much relates to better mental health outcomes. Oh, and the reference is Miles, Cookston, Braver, Sandler, and Deleuze, 2007 there. So when we think about quality parenting, I also refer to it as emotionally intelligent parenting practices. We're talking about being able to stay warm and involved, connected, but also having those limits, understanding children's developmental expectations, communicating with children about their feelings, and also really being able to support a child's healthy relationships with both parents and extended family. And you know, a lot of research cites things like family routines, having meals together as relating to better outcomes for children in many situations. And it certainly applies to children when they're going through major transitions and change in their life. And many studies relating this quality parenting to better outcomes for children, including even less substance use, less depression and anxiety. All of this research, when I was developing the Act for the Children program, my goal was to take this evidence base and translate it into practical ways that parents could use this as a take-home message and incorporate it in their everyday lives with their children. So the Act for the Children program is a parent education program that is 7 hours in length. It has 6 hours of information about children's well-being. I developed the mental health and children's well-being component, and then partnered with a wonderful state Supreme Court Justice Evelyn Frazee in New York, and now it's part of, we have it in every county in New York. I'm happy to say there's parent education available for all parents. And it provides this information and skills that we're talking about for being able to foster children's resilience. And there's also information on the legal process. And the materials are here today. There are DVDs that go along with it, and it's available for dissemination. Everything you need to do this program. I just want to talk for a minute about effective evidence-based practice, particularly when it comes to parent education. And the very first tenet, covenant, commitment is, of course, do no harm. In everything we do, in our practice, in our research, in our programs, our goal, of course, is to be accountable and to be sure that what we're doing is helpful and effective. I've learned over the years about how crucial it is to be sensitive to issues of domestic violence, because you never know who's sitting in front of you when you're presenting a program, when you're working with clients, when you're interviewing someone or doing parent education. And so our goal is to really examine our language and the messages we're giving, because we don't want to reinforce a victim by saying you must cooperate and communicate with an abusive former partner. Nor do we want to embolden a perpetrator by saying your children will do better if you cooperate and you meet, weekly to talk about how they're doing and plan their schedules. So it was an eye-opener to me when I went through every word in this program and changed many things that could have been misunderstood. So we want to be sensitive to issues of domestic violence and certainly not put anybody in harm's way. It's also important to not attribute every problem a child's having to separation or divorce. We all know that children will go through a lot of different things, and we need, or to blame one parent for it. Acknowledging and recognizing that grief is a part of ending a relationship, part of, sometimes people are on different emotional timetables. One person has grieved sometimes years earlier about the loss of a relationship, and the other person is just, realizing that it's ending. And to be able to acknowledge conflict as a way of staying connected. Sometimes when I'm working with parents in these educational programs, I can identify people who are litigating, relitigating, going back to court, sometimes as a way of staying connected with a former partner. So we want to be providing to parents a very positive, empowering message of what they can control, because so often parents in the midst of these major life changes feel pretty powerless, particularly if they didn't want the divorce in the first place. And yet there's so much they can put their energy into, like being able to contain conflict and that quality parenting, having the best possible parenting. And we certainly want to explain those protective factors that we've talked about. I also think language shapes behavior. In New York State, we're working very hard to not use words like visitation anymore. In fact, there's been some reform in our judicial system. And to talk about parenting time and parenting plans. I don't know about you, but if I were a parent and somebody told me, here's your visitation time with your child, you feel so marginalized and it's demeaning. I also encourage parents in their communication, and we're going to be doing some role plays today and talking about this. Instead of saying, well, my son, refer to the child as our child when communicating between parents, and adopting that respectful, more business-like, respectful language and business-like relationship between parents. The program will also certainly focus on reminding parents of the importance of their own well-being and that getting help is a sign of strength, not a sign of weakness. And we certainly want to be able to help parents listen to their children to understand what they feel, but they seldom say. So I think you probably are all very aware of these concepts, and I encourage you to continue your good work. I just want to reinforce what I've just reviewed here. In our work with evidence-based practice, we want to make sure, because our work is time limited. We don't have the luxury of working with children or families or parents for years. It's expensive, time limited very often. So with the limited time we have, let's focus on what we know is going to be the most powerful information for them. So we want to increase our focus on quality parenting as an important source of children's resilience and being able to contain conflict and keep children out of the middle. And that when conflict is reduced or contained, it actually contributes to being better parents because we have the energy and resources. And certainly providing evidence-based practice and interventions. And we always want to give a message of hope and healing. I often think about what's the take-home message that parents are going to take away with them, or if I'm working in a program with children, what will they think about when they leave? And we want them to feel hopeful and to remember that those long-term problems aren't inevitable. And I always like to wrap up a section talking about children with this wonderful quote by Nelson Mandela: "There really can be no keener revelation of a society's soul than the way in which we treat our children." That's my inspiration, as well as children.